And I want you to welcome back to the Morning Blend from Gulfstream Urology. This guy, Dr. Alejandro Miranda Sousa, glad to have you here.
Thank you.
Today we're talking about UTI, urinary tract infections.
Yes, sir.
What are they?
You'll hear UTI all over. It's the three letters that stand for urinary tract infection. The urinary tract is the kidneys, the ureter, the bladder, the prostate in the male, and the urethra. So when you have an infection that could affect any of these organs, we call that a urinary tract infection, or UTI.
Okay, thank you for that great definition. What are the symptoms? How would I know if I had one? What would I be experiencing?
It usually depends on what part of those organs are affected. So if the kidneys are affected, for example, usually come with high fevers, abdominal pain, burning to urinate, not malaise, not feeling great, but usually you're very sick. Back pain is very common.
That's where the kidneys are, back there in the lower back?
Yeah, absolutely, and that will be one of the common signs. Fever, chills, back pain, extremely common for infection of the kidney. If the ureter and the bladder, the ureter will come with the kidney with the symptoms that when the bladder is affected, it's called a cystitis, a form of UTI. It will be mainly a frequency, urgency, cloudy urine, try to go all the time, sometimes it's suprapubic or pain in the lower abdomen. It's very typical for the female who have cystitis. And urethritis, when the distal part, usually gives you a lot of burning to go. More often.
What causes these UTIs?
There's multiple causes. There are risk factors and causes. So causes are any time that a bacteria gets into your system. So when the bacteria gets into your system, initially gets into the urethra. So you can start with a urethritis.
How does it get in there?
There are many other reasons. So one of the common reasons is translocation from the rectal area to the vaginal area. In the female, the rectum and the vagina are very close to each other, and the urethra is very short. So bad habits of cleaning after going to the bathroom will cause, seeding of that. Constipation, extremely common to cause infections.
Oh, we don't.
You have a stone, for example. If you not drinking enough fluids, or you have a large prostate in a male, that actually urine will not flow and will remain in the bladder for a longer period of time. You can have bacterial overgrowth. There's a lot of other and multiple causes.
Sexually transmitted?
Sexual activity will potentially set you up for infection. There are some females that have UTIs after every intercourse, initially because of the friction and because of the short urethra. And some people use spermicides, use barrier methods, condoms that could affect the normal bacteria in the vagina and set up for the bacteria to colonize and get into the urethra. So it's very common that there will be a cause for that.
Let's talk about risk factors. Being female?
Being a female is alone one of the single and most common risk factors.
So women are more likely to have UTIs than guys?
Absolutely. Usually it's not uncommon to have a female have 1 or 2 UTIs a year. If they're only with a little cystitis, inflammation, little frequency, urgency, usually we treat it, not a major problem. But if it comes repeatedly, 3-4 times a year, we need to look into more detail for that, especially if they come with involvement of the kidney. We need to look into more potential causes of seriousness. In the male, usually every infection in the male is considered to be complicated. Why? Because the urethra is longer and the bacteria take a very long way to get into the bladder. So usually there is a problem on how the dynamics, how the functions of the bladder and the urinary tract are in males that will cause an infection. So always we need to explore. When there's an infection in the male, it needs to be evaluated.
So when somebody comes into your office and they're complaining with some of the symptoms you've mentioned, what do you do? How do you...
The most important thing is check the urine first, do a complete physical examination, talk to the patient, see what's going on, see what the frequency of these are, how long they started. There are other confounding factors. The patient has stone, has obstruction. There's things that need to be evaluated. And sometimes we need to do a urine analysis, we do a urine culture to try to identify if there's a kind of bacteria sensitivity or sensible to which antibiotics. So actually tailor the therapy directly to the patient. We try to personalize the treatment. And then look for any other potential triggering factors. That will be a stone or obstruction or a drainage. The patient is pregnant, for example. Pregnancy will increase the risk just a bit, but the risk of infection in the upper tract and the kidney is also affected. So if the patient has abnormalities, congenital abnormalities, especially in children, the risk increase too. Bad habit, not drinking fluids, holding the urine, not wiping properly. There's a lot of things that could potentially cause this. But we need to investigate and treat it because usually they are very easy to treat and the symptoms are not too bad. but they could get out of control, especially patient diabetes, they have immunosuppression, or people that have cancer are on chemotherapy, for example, that the immunity decreases and the bacteria and the infection could get out of control pretty easy. Catheters. Patients that have catheters
that would
also increase the risk quite a bit.
What will drinking cranberry juice do for any and all of this?
So the thing about cranberry is the fluid. So you get more fluid, you reduce your risk. But cranberry specifically has been proven to be protective in patients that have this kind of special bacteria that come from the blood towards the kidney, called the ascending bacteria. It's a form of E. coli. It's one specific bacteria that has been known to cranberry protect towards these bad infections. But overall, it's mainly liquid. It changes the acidity a little bit, so it could potentially have theoretical advantage. Has not been proven on every study, but also you need to be careful with the calories. Juices have a lot of calories.
Yeah, you solve one problem. If you want more info on any and all of this about what they do over at 21st Century Oncology or Gulfstream Urology, you can go to our website, send us the questions, and we'll pass it on. Our website